Hi, thanks for joining me in another one of my educational videos. I wanted to tell you today about some of the options for pain relief you might find in the hospital if that ends up being something we end up doing. Even though I know you've hired me as your home birth midwife and you really want to have a home birth, things can and do happen, and sometimes we need to transfer. So I like people to be aware ahead of time of what their options are with pain relief, so that they can make good informed choices and not show up at the hospital just like completely clueless and not knowing what some of your different options might be. So the one that everybody is kind of familiar with is the epidural, and I have to say I'm pretty happy with what I've seen. Sometimes epidurals are just the thing we need at the very end of labor. If it's been an extremely long and painful labor, for the mom to relax enough, for her muscles to relax enough to really help her pelvis and her cervix open. Sometimes a mom is so anxious, or there's just so much stress and it's been such a long, drawn out process that she just doesn't have anything left to give. And the epidural can just get you over that hump to the other side where you're holding your baby. So I've seen that on a number of occasions, and it really can be a blessing. And, the side effects are there, but they are, a very small percentage of people get like bad side effects from the epidural. So it works really wonderful in the cases where it is necessary. So it can be a number of drugs, and it can be a combination of drugs too, depending on what the anesthesiologist deems necessary. It's oftentimes an opioid, such as fentanyl, or it can also be what is known as like a local anesthetic, such as lidocaine, can be used in combination or separately in the epidural, which is a small tube is placed into the dural space in your spinal column, and medication is like periodically released or continuously, depending on, again, what is going on, what the anesthesiologist wants to do, into the dural space. And this is what's used usually for C-sections these days. They don't put people completely out. They just numb them from the waist, or the abdomen, the uterus down. So that is one of the important side effects that you need to understand about the epidural, is that once you get one, you're not going to be really moving into a lot of positions, at least not on your own. If you have helpers that can help kind of move you still, it is possible sometimes to labor in different positions, but you would have to have someone help you and hold you in those positions, because it's impossible to hold yourself up once you've had an epidural. Your legs are completely numb, your body is numb from like right about the diaphragm down usually. So that can make laboring difficult if you are dead set on, being upright, moving, and things of that nature. But if you just need to rest, if you need to sleep, you're having contractions, and let your body do the work without you putting in the physical effort, it can be wonderful. And I've seen people, take a great nap, dilate all the way while they're napping, and then wake up and push the baby out. And that is just great. That is when we really like the epidural, because it works really, really good for that. There's also the option of getting like fentanyl intravenously, not through the epidural, but into your, arm, or wherever they place the IV in your hand. That is another option that can be really helpful for a mother to relax and rest, and can provide great pain relief. There's also the option for a patient-controlled opioid IV. You may have seen the buttons that people can push when they're in a lot of pain, like post-operatively or or in labor. And then, so they give you a little clicker, and obviously there's a maximum amount that you can administer to yourself, but you use the little clicker, and the clicker releases pain relief into your IV. So there's that option, which is really great. Actually, it's incredibly good for people if they have a low tolerance to opioids, because at a certain point they get drowsy enough that they can't click the clicker anymore, and so the machine doesn't administer any more meds. So that can be really great for people that maybe can't really tolerate opioids very much. There's also the option now of nitrous oxide in a lot of places. That was known as gas and air in British hospitals, and it has since migrated to the United States. We've seen it have great success in our hospitals as well. It does temporarily decrease the oxygen level going to the fetus, going to the baby, while the mom is breathing in the nitrous oxide, because she's not breathing in oxygen, obviously, at that moment. But as soon as she stops breathing in the nitrous oxide, the baby's level of oxygen goes right back up. So, and it's great at providing pain relief too. So it, you might know of it as, it used to be called laughing gas. So it was used a lot in dental procedures in the old days. And now it's used for labor and delivery, and it works really, really well. A lot of people really swear by it and really like it. And you can still move, you can still do all the things that you were able to do before. It just numbs the pain to some degree. There's also local anesthetics like the Pudendal block, which is a block made out of lidocaine that they can give you. So again, kind of like the epidural, there would be a little bit of a tube, a little tube going into the dural space of the spine, and they would be giving you lidocaine, and it would numb you down, you know, from the level of the where the tube goes into the spine down. There's also injections of lidocaine that can be used. That's usually for like after if there's a tear in the vagina, or there's not an epidural, a episiotomy cut. A lidocaine injection is given at the site of the tear or the episiotomy to numb that space so that the repair can be done. So that's just the brief overview of the main drugs that are used for pain relief in labor, and we can talk a lot more about it in person, but I just wanted to let you know that those are kind of what is available for you if you transfer in. And yeah. I wanted to also say that the lidocaine is something that I also carry, so that's not exclusive to the one for doing suturing and repairs. That is not exclusive to the hospital, so don't worry that you'd have to like transfer afterwards if you have a tear or something. We can do repairs at home, and we carry lidocaine with us, so we can give that to you as well. So all right.